Welcome to Wellness Radio with Dr. Jeanette-Gallagher as your host. Her show discusses topics of health, wellness, and spirituality, and is about discovering your place in this great universe, from your cells to the cosmos. Along with her guest, in casual conversation, she strives to ask the difficult questions that may be holding you back from a vibrant life, and shares new ideas that may inspire you to make a change in your life that you only can see in your dreams. And now, here is Dr. Jeanette-Gallagher.
Good evening, everyone, and welcome to Wellness Radio. This is Dr. Jeanette-Gallagher, and it's a pleasure to have you with us here this evening. Tonight we are going to be talking about our mind, our thoughts, our emotions, our body, our diseases, our connections, and how are things kind of looped together. As I've shared so many times over the last decade, is that we've gotten into the point where we tend to farm out pieces of our body to different specialists, to different people to take care of it for us, to tell us what to do or how to fix it. We all know, you go to the priest and he will fix your soul. You go to the therapist, they will fix your mind. And you go to the physician and they will fix your body. One time I had spoken to someone and they said that they were having trouble with a blood vessel. And I said, well, which kind of doctor did you go to? They said, it was in my toe, so I went to the foot doctor. As if that toe was not connected to the leg, to the heart, to the mind, to the rest of the vascular system. We have separated ourselves so far out. Have we now come to a point where we are saying, I'm not feeling well, something's going on, I'm so separated out, I'm taking so many medications, I have so many diagnoses, and I'm saying, I don't really know where I'm at this point. Is there something more? Are these things connected? Is there a web of life? Perhaps maybe you say, maybe my toe is connected to the blood vessels that something's going on in my head or in my heart, or maybe what I'm taking into my diet. Perhaps it's my medications that are interlooping or causing these issues. All of these possibilities are out there. The point is, how do we find a true path to be able to find a way out of where we are to a different way of looking at our body and our mind connection? Is it truly possible? There's so many wars going on these days between all the professions. We say, you go there, I'm not going to talk to you anymore. I'm going to cancel you as a patient. Another one says, you go there, good for you. I'll send you there. I'll give you a referral. But we still don't get to the point. We want to be healthy. We want to be heard. And we want to feel like we're doing the best in our world. Today, my guest is Dr. Samuel-Mann. His book is Hidden Within Us, A Radical New Understanding of the Mind-Body Connection. And truly what we'll be talking about today is, what is the first step in saying, wow, is there something different? How is my mind and body connected? And potentially, could this have repercussions in the health of my body? Dr. Mann, thank you so much for joining us today. It's a pleasure to have you with us.
My pleasure, too.
I'm so glad to have you. Just as I shared on this, don't you think there's been a lot of wars in the past few decades? We all got farmed out as more and more specialists came along, and now we're saying we need to find a way back. Do you think?
Yes and no. I think part of the reason, there have been decades of research, of mind-body research, and everybody was looking for that connection and how it can alleviate medical disease.
Right.
And after decades of that research in medicine, it did not pan out, and it did not turn out to offer a different pathway to treatment of various medical illnesses. Mm-hmm. And my specialty, what I talk about is a number of medical conditions, but my specialty of hypertension, that was the classic mind-body disorder, probably had more mind-body research than any other area. And at the end of decades of research, it has not helped us. And in fact, most people with hypertension, amazingly, it is not a mind-body disorder. So if we are to maintain a view of the mind-body state, it has to be different than what has been traditionally studied.
Yeah, I think that we've gotten into the point where we've kind of taken the words, created a theory, and put it in a cubicle. And we only looked down that road with blinders on. And what's happening now is we're saying there is more to the story, more to the theory, and perhaps there are different avenues to explore it. Just as your book, Hidden Within Us, can we find out what are the emotions, what's happened in our childhood, perhaps what's even happened decades ago, or maybe what's happening today. It's creating a web to look at for our health, instead of saying there's just one road. You know, everybody says the root cause, and I'm going, dude, a tree does not have one root. You got a long way to go, you know? So there are many different aspects to look at, yes?
Yes, and one interesting aspect is there are many medical conditions where they are chronic conditions, and we don't know what causes them, whether you're talking about migraine, inflammatory bowel disease, autoimmune disease. We have medications that can help, although they can have side effects. The medication can require lifelong administration. We know the pathology. We know that there are inflammatory markers that indicate the inflammation caused by the disease. Mm-hmm. We don't know what triggers it. Chronic fatigue syndrome. We don't know the cause. All the blood tests are normal. We don't know how to treat it. There are so many mysteries out there begging for an explanation, and the traditional mind-body view did not provide it.
Yeah, and I also think too, is to notice that use exactly the word you said, there are many different things out there. And I think what we're coming to is that there's not a blanket answer for all humans. What we're looking for is, what is your uniqueness you're presenting me with today, and how can I help guide you through finding some answers for yourself? Isn't that truly the core of the essence of your work and your book?
It is, and at one level, say in treating hypertension, and this is true for many other conditions, you have guidelines that tell doctors what to do.
Right.
The problem with the guidelines, there's no individualization of treatment. It's the same recommendations for everybody. And when I see a patient with hypertension, and I've been seeing patients with hypertension for decades, every patient is different and needs a different approach. Yeah. And I'm not saying, and I think it's important to clarify, I'm not saying all medical illness is a mind-body disorder. In many people it is, in many people it is not, and we need to study better how to differentiate that.
Yeah. It's almost as if let's go through the first process and we'll see what we come up with. But you know what I think happens too, Dr. Mann, is that a lot of people will say, you're only as good as a doctor that he has to put in his epic, I mean, you're really just data collecting. And once you data collect, you push the button, and out on the bottom it says what you're to do, and you have to follow those principles. So in essence, has the evolution of the medical practice confined us with blinders that we're finding it really hard to be able to do the work that you do, or to be able to explore something different and saying, well, maybe times have changed. Maybe there's some new information out there. Maybe there's another way to look at what's going on with me. Do you think it makes it harder?
I would like to say you're wrong, but I don't think so. And part of it is we need to get clues. And in the questions one asks a patient, there are clues, and it depends what we ask about. And we go through a script of asking certain questions, but the answer is often beyond the routine questions. And it's not just taking the most conclusions from the information you get. It's about getting more information and in terms of mind-body, it's not just about day-to-day stress. And I see many patients where they don't have much day-to-day stress. Things are pretty good, and yet it is mind-body.
Yes, and also, too, let's talk about asking those questions. You know, I myself had gone to a doctor the other day, and I just said, you know, I always don't tell them who I am or what my training is or anything, you know. And I kind of just sit back. I just give them my name and my, you know, what do you do? Oh, you're retired. Just leave it at that, you know. And I was shocked by the questions and even further shocked by what was not asked. And it was exactly what you're talking about in your book. You know, she had asked me a question, and I had said, oh, well, I had, you know, she asked me something, she said, about your family or whatever, and I said, I don't have any answers for you. There was a lot of dysfunction in there. And that was it. She just let it go. And I went, whoa, wow, look at that. But don't you think also, too, Dr. Mann, the answer is you don't ask the questions, and this has always been in our training and yours, and I'm sure you can remember it. Don't ask the questions if you don't have a way to treat it. If you can't, put it down and give it a code and have a treatment for it. Do not ask the question. Yes?
Yes, and also people don't realize there is a huge time pressure in the medical practice because talking to a patient is the least compensated work you do.
Right.
And there is always time pressure. And in fact, in my practice, the only time where I have enough time to ask those questions is usually the very first visit because you have more time scheduled with the patient. And on the one hand, if you don't get the information then, you might never get it.
Right.
On the other hand, that's the visit when you have least acquaintance with the patient. You don't know the patient yet, and you're in a position where you have to ask very personal questions of somebody you've just met. And that's something that I do very delicately, and I literally tell the patient, I need to ask some personal questions. I hope you are not offended. And 99 times out of 100, the patient will say, oh, no, that's fine.
Right. Because when you start to ask those questions, it's almost as if you have opened up a can of worms, so to speak, or a box of secrets, or you have opened up someone's chest that they've been holding onto for so long. And just as you know, working in hypertension and anything like that, I mean, goodness, isn't that what we want? We want to open them up so they can let go of all that they're holding back. But when you ask a question, it's sort of like the tears would start coming, or the stories, or sometimes anger, sometimes rebellion, sometimes shutting down even further. All of these things are options that show up when you start to ask those questions, right?
It's very interesting. And, you know, if I have a patient who's under a lot of stress and we talk about it, yes, they can get teary, but that's something they are aware of. And it's different than, for example, if somebody has a past history of trauma. Right. And if they have repressed the emotions, they've never really felt them. And the emotions were repressed at that time for good reason. Yeah. So, for example, if somebody has a history of childhood trauma, it is beneficial if that person, particularly if they don't have emotional support, to be able to have the emotions blocked out of awareness. And in talking with patients, I emphasize that repressing emotion is not psychopathology. It's a defense that the human race was born with, which helps our emotional resilience. That's how we get through rough times. And it is so important. And evolution had to give us that ability. And I hear it again and again. And as far as your question of, well, what are we opening up here? And your question brings on the important issue of, am I opening up a Pandora's box of emotion? Right. And I used to worry about that. And that has not been the problem that I was afraid it would be. The problem is actually the opposite. The problem is these emotions, without our awareness, have been blocked off, and the problem is that it's hard to get them into awareness. And if it is something that they cannot handle, I've not experienced the patient getting in touch and falling apart. They are too well defended for too long to have a simple conversation expose them to something they cannot handle. And what I emphasize, if it comes up, you can handle it. Your defenses would not collapse just because I asked a couple of questions.
Yeah. And I think also, too, that definitely it's the clientele. If you look at it, I'm over 65 myself, and we always think, gosh, look at how we grew up in the 50s and 60s. It was not pretty. 90% of the people had grave issues because they had parents or grandparents that came off of war, off of the Depression. Many of them hadn't even finished 8th grade. Many did not really even know how to be able to take care of their families or whatever, or many of them had a lot of generational pain that got passed down. So if we really truly look at it, that stuff really gets passed on over and over and over. I mean, we hear our grandparents saying, suck it up, just keep going, or, yeah, well, let me tell you my story. You want to whine about it? A lot of these words and these phrases, many people have heard day after day after day, and they got to that point where it was total shutdown. This is what you do. Just keep going through it. Just keep going forward, You got to keep going up that ladder and kick anybody off that keeps trying to pull you away. Don't you think that's pretty much the way that people have navigated their lives?
Yeah, I think there are many who, yes, follow that path, and many others. And it depends on so many things. So, for example, if there was an awful father but a very supportive mother, and also, there are questionnaires, were you ever hit? Were you ever emotionally abused? And it's a continuum. There's no absolute yes, that person was abused, or no, he wasn't. And it's interesting, and I'm going to say something that probably a lot of people might disagree with. For example, if I ask, were they ever hit? And there's a difference between a patient who, yes, they were hit. The father was alcoholic. Depending on if he had been drinking, the child would get hit, or if he was in a bad mood. That's different than a patient who will tell me they were a bit on the wild side when they were little, and the parent said to them, you've done this again and again. I've told you, no, don't do it. And if you do it again, you're going to get hit. And then he, the patient, went out, did it again, and he got hit. Not beaten to death, got hit.
Right.
And those patients, I have found in general, happen to be very well-adjusted, likable people. And yes, they would say on the questionnaire, yes, I was hit. But that is day and night different than the unpredictable parent or the parent who had a mood disorder and that kind of getting hit. And it also depends, was there someone in the family that they had connection with? I use the word savior. Just somebody, anybody in their life that they were connected to. And some did and some don't. There's so many variables here. And it's not an absolute, this one was a trauma survivor and that one wasn't. It's a continuum.
Don't you think it's truly, Dr. Mann, the basis and the core of the perception and the judgment that we had over our experience? And if you look at it, so many times when we talk about the heart and the blood vessels, it's truly about survival. Because when you're hurt, 1 second it's beating, the next second it's not. You're alive or you're not. So it's really, how can you be safe in this world? So many times people will say, I don't feel safe in this world. And you ask them, what is that all about? And that's when you just start going down this rabbit hole, and you've opened up, just as you said, Pandora's box, and you're going, they're not safe. And how is it playing out? Yes?
I think it's more complicated than that. And one important thing that I mentioned in the book is I see people who have been through trauma, who have the emotion is repressed. They're not aware that they have repressed the emotion. The unconscious mind did it for them and have survived horrible stuff.
Yeah.
And the interesting thing, and a point I want to emphasize, is I see these patients, and many of them are successful survivors. They are not depressed. They don't suffer from anxiety. They are the best of the survivors, which is confusing because it's actually the ones that feel the emotion throughout their adulthood and suffer from it. Those are different, whereas I'm talking about somebody who moved beyond it. Oh, yes, my childhood was terrible, but it never affected me. And on the one hand, that was a gift that repression enabled them to survive and thrive. On the other hand, those emotions have never been dealt with. They linger. And as I describe in the book, those emotions from history decades old linger within us, even though we are not aware of them. And I think the traditional mind-body thinking focuses on the emotions we are aware of. And my observations in so many of these conditions, it's those who are successful survivors who are not suffering psychologically, who have the effects of those lingering emotions that have never been experienced or dealt with. And again, it was exactly what they needed to do at the time. And I emphasize so strongly to those patients, you had the gift of resilience that repression gave to you.
Yes, because, so many times there's so many therapies out there, and they say, we have to go back there. We have to go back in regression. We need to go back there, and you need to feel your feelings. And the answer is, no, you don't. You can understand it. I hear you. And, if it's playing for some people, they may need to do that, but many others don't need to do that. They can understand it, and they say, I got it. So I think sometimes the idea that we think that there's only going to be one way to help patients, and that's going to be the blanket thing over your whole practice, is to understand that that is not true. It may be something different for everyone, yes?
Yeah, that is so important. And, for example, a patient who I saw with unexplained episodes of blood pressure elevation for a few years that was wrecking his life, and no current stress, but he had a past history of being a Holocaust survivor. So then the question is, does one suggest to this person to feel his feelings? Yeah. And the answer was pretty obviously no, he can't go that way. Right. But there are other ways to go and treat based on the knowledge that this is likely a mind-body disorder linked to emotions, overwhelming emotion, that then and even now is not something he should deal with. And fortunately, I think the mind protects, and again, even if I encouraged him to feel his feelings, which I wasn't going to do, it's not going to happen. The mind has protected him from those emotions for so long. When it's not an option, the patient at some level...
I think also, too, the body also protects us because, an emotion might come up and you might have a sudden burst of hypertension and you end up at the doctor and the doctor can help you and you can find or get through something. You know what I mean? So, in other words, we are, as humans, this human organism is pretty well equipped at ringing the trigger bells, so to speak. Whatever shows up, let's look at what is your trigger, where is it coming from, and what is it rooted in. And that's what we're looking at, is what is your trigger bell. Let's talk for a second, Dr. Mann. Also, too, people will say, well, I'm getting stressed out and my blood pressure's going up and down. And you might take their blood pressure and it's not doing anything at all. You may have others that will say, I'm going in and it just seems like I have this chronic hypertension and it's just not getting any better no matter what kind of drugs I take, no matter how many times they send me to the therapist, I'm not getting any better. don't you think that in between there's a million different spokes in the wheel of each patient? And how do you start your path of helping people when they say, as soon as you take the blood pressure and you're sitting there and you're going, what next?
Right. My approach, first of all, whether it's hypertension or inflammatory bowel disease or migraine or autoimmune disease, one question is this, in this patient, a mind-body disorder, or does it have nothing to do with emotions? Mm-hmm. So using the example of hypertension, first thing is we have a fight or flight reflex, the sympathetic nervous system that arouses us in case of danger. And emotions stimulate the sympathetic nervous system. When somebody is facing stress, you get an increase in sympathetic nervous system tone, an increase in adrenaline secretion, and the heart rate can go up, the blood pressure can go up. That is not hypertension. That's a normal reflex. So if you measure the blood pressure in anybody at a stressful moment, the pressure can be higher. That does not mean they have hypertension, but a lot of people, based on that, are diagnosed as having hypertension and placed on lifelong medicine when, in fact, they didn't even have hypertension. Some patients, when they're in the doctor's office, they're frightened, their pressure's higher. They end up on lifelong medicine that they don't need. So first thing is the temporary elevation of blood pressure is normal physiology. That's not hypertension. Second point, the majority of people with hypertension, it is not mind-body. It is genetics. About 40% of it is explained by genetics. Mm-hmm. Another 40-50% health habits, diet, salt, weight, exercise are all factors that affect the blood pressure. And I find that in 80+% of patients, it is not a mind-body disorder. And that's very important to recognize, because I don't want to send a patient to a psychologist because they have high blood pressure that has nothing to do with mind-body. Where it is mind-body, and this relates to other conditions also. We talked just a moment ago about the fight or flight reflex, the sympathetic nervous system. Studies show an increase in sympathetic tone among many of the patients with autoimmune disease, with inflammatory bowel disease, and other conditions. And it's a fight or flight reflex that's going on about emotion we're not aware of. So they will sit there, I feel calm, but their sympathetic nervous system is overactive from emotion that they are not aware of. And that offers an understanding, and particularly in hypertension, what medication do you use? Genetic hypertension is mostly about the kidneys, and I use medications targeting the kidney mechanisms, as opposed to a patient where it is mind-body, and I use medications that target the sympathetic nervous system. And in other conditions, drugs that target the sympathetic nervous system can also be very effective if their condition is driven by the sympathetic nervous system and by repressed emotion.
What about the idea that as you progress with therapies and treatments, people start to feel like they get exposed or they're vulnerable? Like, oh gosh, she's asking this question and now I'm going to be found out, so to speak. And I think sometimes you see it in the cases of people when they sort of hit the wall. In other words, the emotions just like, wham, something out of nowhere just came up, and it can end up being a heart attack or a stroke or something. You know, all of a sudden they just hit something. And it's almost as if, what is that energy wall that hit you just then? And sometimes it's our conscious awareness where an event may have brought it on. Or it could be something that got opened up as a can of worms, and you may not even know it, and it could be totally out there. And the case is are both of those relevant, or are they both irrelevant?
Well, it's often hard to know. I mean, if a patient experiences a sudden cardiac or other medical event. Very often it's just the sudden worsening of a condition or a clot, or it's the nature of many things to have a sudden presentation. And I don't attribute that necessarily to mind-body. In some cases, absolutely. And it makes it even more complicated when it can be about emotion they're not even aware of. But usually the sudden event is a result of months or years or decades of simmering emotion beneath awareness.
Yes.
But again, the acute event, I can't tell the patient, oh, this is related to emotion. I can't do that.
Right. Yeah. But I think also, too, the idea is that it eventually comes to a point where sometimes that opens up the person. It can, definitely they're like, I just don't know where you're going with this, doc, or, hey, I really don't know, but you referred me to someone, and I think I want to try that out again, or I think I want to explore that. Or perhaps you'll get others who will say, you know what, I got it, I'm good to go, and I'm going to keep everything where it is, and I trust you what you're telling me to do. Sometimes I think when people feel unsafe, they're afraid to answer the questions correctly, or they're only going to give you the answers that they think that you want to hear. That's when it's sort of that simmering pot. They're still in that simmering pot, and you go, gosh, I've been treating this patient for a long time. I don't understand. Where did that come from? All of a sudden. And it's because they hadn't been truly opening up and ready to work within the process. Sometimes we see it because they've kind of been just still dodging it, so to speak, or maybe regressing or repressing or a denial or whatever it might be. Do you think that vulnerability plays a huge role in this?
It's a complicated thing when we're talking about medical illness, and these are questions that I don't think have been adequately explored. In my experience, there are patients who have a horrendous history in terms of trauma or abuse or whatever, and some of those patients, their answer will be, it never affected me. They are completely unaware of any emotion related to it, and they will go on like that. Doesn't matter what I say, it's blocked off. Some patients will say, yes, I went through tremendous trauma, I'm okay, I don't want to go there. And that's okay, because it always has to be the patient who makes the decision, not the doctor. Then you have patients who have been through trauma, have never felt any of conscious awareness of emotional distress, and as a result of discussion, it reaches conscious awareness, and they get it. And the interesting thing is, even before or without psychotherapy, they get it. And healing can occur. It's amazing our ability to have spontaneous healing like that. Then you have the patient who is now aware of it. They may want to go to psychotherapy to further deal with it. Although there are others who, they come back 3 weeks later and they've been feeling it and dealing with it, and they feel relieved and they don't need psychotherapy. The question is, what about the patient who has no awareness of emotion? Can you send them to a psychotherapist to deal with it? And again, that's something that has not been explored. It's people who have emotional distress who want to see a psychotherapist. If they have no emotional distress, it's that repressed, they don't have the motivation to go to psychotherapy. And if they go to psychotherapy, there's tremendous resistance to getting in touch. It's not easy. And that's another reason why I don't push patients to psychotherapy if there's just no awareness of the emotion. And I respect their answer tells me the direction to go. And so, yes, one has to be careful, but I trust the patient's defenses. If it's something they don't dare go near, they won't. And if it's something that,
How about the idea of when you start breaching these questions, I think that really brings us back to our soul and our faith, our beliefs, love of self, love of others. And you will say, I've been going through a divorce or these things. This is my second or third one. Patients will say that, or people will say, really, I don't believe in God anymore. He hasn't helped me before. Why is he going to help me now? So I think the idea is that sometimes when people have a medical condition and they seem to hit a wall, so to speak, people will reach out to the old tools that they used to have. Well, maybe I'll go back and I'll talk to my family. Perhaps I think I'll start going to church again. Or maybe I will start taking care of myself and a little more self-care and self-love. Don't you think all of these aspects, when you start asking the questions, opens up so many other doors of therapies and treatments and for ways that they can see themselves?
It's a good question, and I cannot give any answer with certainty. Again, it gets back to, well, first of all, an important thing is, do they have the stability and support in their current life? If their current circumstances are not good, they need to keep repressing because they don't have a support network. If they have a support network, their career is okay, their family, they have family, then there's more of an option to deal with it. But a lot of these patients, and I think a key thing here is that when their current circumstance is not good, are they depressed, are they anxious, or are they saying, oh, I'm fine? The patient in that circumstance who says, I'm fine, you can't go anywhere. The patient who is aware of distress, then the question is, can you take that anxiety or depression and work with it, or actually the patient work with it in a more positive direction? Mm-hmm. And that's a challenge, and an important challenge in the lives of so many of us. Yeah. And we never figure it out.
That's true. That's so true. And let's talk about the idea of medications, because sometimes medications can end up, when you take a medicine, you think it's for your heart or your blood vessels or your mind or your consciousness. There are a lot of side effects. Anything you put into your mouth has repercussions in many other different systems, within your human organism, the chemical reactions. Things have a lot of different things in there. Do you think that sometimes prescriptions may or may not influence the path that you're trying to be able to help someone walk, and also sometimes too many medications? You get into a swamp and you're like, we just can't get out of this right now. Maybe you just need to be stable for a little while.
I have about 3 or 4 answers for that. Mm-hmm. One, I think it's a common medical practice. A patient, for example, for blood pressure is on medication A or A and B, and the pressure is still out of control. The doctor will add medication C and D, but will not stop A and B, which weren't doing anything.
Yeah.
So I think too much medication is often used. Too many doctors are treating more aggressively without observing, are things getting better even without increasing the medicine? Mm-hmm. Another problem is, again, is the medicine the right one? If it's for a process that involves the sympathetic nervous system, something like a beta blocker can be very helpful. Whereas if it's genetic hypertension, you don't want the beta blocker, you want drugs targeting the kidneys. Mm-hmm. Beta blockers, and I'm going to talk about 2 drug categories, beta blockers and antidepressants. Beta blockers are a very interesting drug. If I have a patient who, whatever their medical condition, and if they have a lot of anxiety, beta blockers block the effect of adrenaline. Yes. And patients get enormous calming effect from the beta blocker. And what's fascinating is that happens even with a beta blocker that does not get into the brain. just the blocking of the adrenaline. And I have patients with anxiety. I give them a beta blocker, and they feel much better. Their pressure is better. Their anxiety is better on that drug that does not get into the brain, and they don't need a psychotropic drug. It avoids the need for the patient to take a psychotropic drug. One downside of the beta blocker is if you look at the best-selling beta blockers, and almost no doctor realizes this, the best-selling beta blockers get into the brain. And they can cause funny things, tiredness, mental dullness. Patient, and it's subtle, and they don't realize it, and they just are mentally dull on that beta blocker that gets into the brain. And to give you a couple of names, metoprolol, carvedilol, which is Coreg, I don't prescribe them, even though they're the best sellers. And they just can't describe it. It's subtle. And I say to them, you feel stupid. And they say, that's it. And I get them off that onto a different beta blocker, and they feel much better. I can't overemphasize the importance of that. I think about 20% of people on a beta blocker have that side effect. So that's one thing about the beta blockers, and it avoids the need for psychotropic drugs. Finally, the issue of antidepressants. And I think that's an important category in treating patients as a physician, is when to consider prescribing an antidepressant. And here's the catch-22, and I'm curious what you think, Dr. Jeanette, about this. When I prescribe a antidepressant, patients get relief from that. It helps block off the emotions that have been relentlessly troubling them, and these are very valuable drugs. On the other hand, that blocking, keeping the emotions out of awareness, I believe makes any kind of therapy of getting the emotions out harder to do, because the patient doesn't have access to the emotions, because that's what the antidepressant is supposed to do. So I rather give it a little time to see the willingness of a patient to deal with the emotions before giving them that antidepressant. But if they've been suffering for years, absolutely, those drugs can have such an effect on their quality of life.
I think it helps for a little while, because what it does is it gives them a break. In other words, their body is so on fire, trying to hold things off or whatever, that when you give it a break, it has time to breathe and regenerate. And then maybe they were able to be okay to slowly wean off after maybe a year or two. However, when you sometimes do give these medications, you see people that are all of a sudden, gosh, I see this all the time. They come home with this first, blood pressure medicine. I'm going, my gosh, they'll ask you silly questions. Just as you said, they'll feel stupid, It's sort of like, you put a thing of milk on the counter, and they're like, do I put this in the refrigerator? And I'm like, why are you asking that? Where do you think it goes? Do you know what I mean? And they don't even, and then they get this aggression. And it's sort of like, was the question the problem or the medication, or am I now seeing aggression showing up? So in other words, other feelings, other things start to show up, and we don't even recognize it. Unless we're, like you and I, we're very keen and we're very aware, ooh, look at where that's taking me. Because man, boy, does aggression show up like crazy. And then all of a sudden, then they have an MI 6 months down the road, where they've got, problems with their liver, or all of a sudden they're blowing out their pancreas, or gallbladder stones or something. So, the answer is we don't really know, but I think that what you and I have shared today is about the mystery of the body, all of its chemical reactions, all the ways in which we engage in the world we are in today. But what we're sharing is there's some other options to explore, because I don't believe you and I will ever find, nor will anyone else, a path that says, oh, I see that in you, let's go down this road and here's your answer. But what we're doing is we're truly saying, I can walk with you and guide you along a path, and we'll see how things work out. Isn't that what we really want?
I think you hit on something that is extremely important. Two things. One, I can see patients, their life is fine, and now they're suffering from anxiety, and they don't understand that life is good, work, family, everything is good, and I'm anxious, and I don't know why. And then I'll take their history, and they've been through, in the past, overwhelming stress or prolonged stress. An immigrant who came to this country, doesn't speak a word of English, has no money, nothing, alone, gets through all those years with hard work. And then now that everything is good, they're feeling anxious. And I can talk to that patient and I can say, you know, the anxiety you're feeling now, you didn't feel it then. And they'll tell me they didn't feel it then. Right. If you take that anxiety now and put it back at that time, it fits perfectly like a piece of a puzzle. Yes. And if they can realize it, instead of living forever with the anxiety, to at least appreciate what they went through. It is so important to realize that.
You know, I think it is so vitally important what you just said, because we can all go back and look at our lives, you know, growing up 40s, 50s, and 60s and say, oh, and now we're looking at it with today's eyes, 2022. We're saying, I look back at my childhood and blah, 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 and blah, 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 blah. However, you're doing a retrospect journey and condemning and judging with shame and guilt that which you have experienced in the past with the eyes of today. And that's not going to get you anywhere. What's going to get you anywhere is to go back there and say, blah, 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 and I had all these experiences, blah, blah, and you know what? You turn to the next person. You could be at, like, let's say a women's group or a men's group, and you could turn to them and say, let me tell you my story, blah, blah, blah. And you know what the next person will say? Man, I'm one up on you. Let me tell you mine. And another one will say, I'm up on you. Let me tell you mine. And you will realize that everyone that's been in that same generation has 90% very similar situations. And it's just how we are perceiving and dragging up and dredging the past to be our present. So in essence, why are we consistently living from the past when we need to live in the present and sort of cut those tether lines to the past? We can cut those tether lines to the past and we live in the present. We really, truly can see life in a different way. So I know, I mean, there was a group of women I had spoken to on the radio on one of my shows, and what we were talking about is, you know, the women said that, you know, hey, let's throw our hat. Oh, man, my father did this, or my husband did that, or I used to beat my kids, or I used to do this or that, or whatever. And what happened at the end of the meeting was that they all felt a release. They all felt it could get out. Many cried, many were angry, but they all felt supported. They released it. And let me tell you, those women said, we want to do this every month. We want to keep doing this until we've got no more. Because when we've got no more, then we're no longer living from that. This doesn't come up anymore. Isn't that the freeing path that we're really looking at for people?
Well, it's also, I mean, there are a lot of people who are aware of the emotion, aware of the past history, and they can't stop reliving it. They can't get out from under it. And what happened then just is a shadow over them as they live the rest of their life. And, you know, what are the answers? Well, one answer is you deal with it, get the emotion out, and move on. But they somehow are just unable to move beyond that. The other answer is repressed. And although dealing with it is more optimal than repressing it, at least with repression, they get to move on. The other thing is, I'm going to mention a pet peeve. I believe that psychotherapy can be of great value. But one thing I don't do, and it's my pet peeve, is psychologists who basically say, you know, come to sessions, I can help you.
Yes, correct.
Now, if I'm talking as a physician with a medical condition of a patient, I can help you because we can diagnose it and then treat it. Yes, I can help them. But when it comes to dealing with the emotions, especially major emotion, I never say I can help you. I can't.
Right.
The patient has to be the center of it. I can convey to you what my understanding is, but it's the patient who has to help themselves. Almost saying I can help you is so disempowering to a patient.
Yes.
It's the patient who's the one at the heart of it, and the patient has to take charge. And that's a message I like to get across to the patient, that, hey, you repressed what you needed to repress. Trust yourself. If it comes up, you can handle it. And some will and some won't, and maybe there are better ways to enable more patients to get in touch with it, but stuff that remains that should be forbidden stays forbidden. The mind's ability to repress is powerful and crucial in human survival.
And it's about being able to find the right people to help you along your guided path. Because just as you shared, you can go to a therapist and you could be all ready to just maybe, like I said about the women's group, you're really ready to get it out. And then at the end of the visit, they're handing you a prescription. You're going, what the heck? Now you want to shut me down? Now you want to slow things up? Now you want to trigger or control my outbursts? My outbursts might be what I need. I might need to be at a women's group or men's group, and, hey, we're all going to go to those places, where you can throw dishes, the stacks of dishes, and we're going to get out some energy. We're going to go for it. But yet, if you go to a therapist, they're like, oh, you break things? That's not good. You know what I mean? And you get really stuck in this loop, so to speak, I think the overriding... I think the overriding thing, Dr. Mann, hold on. I think the overriding really main thing is who is going to support you where you are today. That's where you and referring and helping others is vitally important. Who's going to support you where you feel you need to be? Yes?
I think that's a very important part of it. And the other is, aside from being supported, can you trust yourself to feel the emotion? Yeah. And I think a good therapist enables the patient to trust themselves, as opposed to the therapist, well, obviously you have problems. I can help you, which is the opposite message. And I think that's very important, that patients can handle more than they realize they can handle. And they need to trust themselves. And I think that's a very important piece of it.
Yeah, because we've really gotten into the loop. In closing, I wanted to talk about this, is that we've really gotten to the point where if you look back at the early 1900s, all of a sudden antibiotics came along and people said, oh, good, hey, doc, I've got this cut here. Can you fix it? Sure, here's an antibiotic. I've got this problem. Can you fix it? Yeah, here's an antibiotic. Then, decades later, hey, doc, I've got this pain. Can you fix it? Sure, here's an opioid. Here's a pain med. So we've kind of gotten to the point where we spew where we are what we need. We're expected to get back something that's going to passively take care of the issue, but yet we go along our normal day. When in essence, what you and I are talking about today is how can we see ourselves as participating in the health and healing of our own body and mind self? Because we are responsible for where we are. And I think that's important, too, to note. Because if you don't go into the doctor and say, hey, doc, I need another way, this isn't working, you've really taken responsibility for yourself. You've made the stride. Or to say, oh, yeah, I really felt that emotion. Something's wrong. What do you suggest? You've opened it up. You've taken responsibility. You're not in this pattern where someone's going to fix you and hand it back to you and you just passively stick it onto your, human wetsuit and you're out the door. That's not even at all what we're talking about, right?
Yeah, and again, A lot of the issue can be emotion somebody is not aware of, and it just would never occur to us that ailment X might be, if it is a mind-body disorder, our most powerful emotions are often emotions we are completely unaware of. And again, in many, it's a gift, the ability to be unaware of it. And I think that is the element of the mind-body connection that is overlooked, as opposed to, oh, I've been feeling anxious and that's why I have this autoimmune disease. And that research did not pan out. And often it's a problem where I look at it as when repression fails, the repercussions of that persisting emotion can be enormous. And it's a matter of clinical judgment of should this person be on a pill, or should they be, if they could recognize where it's coming from, there is a healing path alternative to just more medicine. And I think we need to begin to explore that further. And it is, in a way, the opposite of what so many think. So many think it's the anxiety and anger and tension that they feel that gives them disease, whereas in my experience, our most powerful emotion is often an emotion we are not aware of, and that's a part of the mind-body connection that just has not been studied or looked at.
In closing, Dr. Mann, I had a guest on the show one time, this doctor and I, we were talking about the heart, and he said, the heart is not a pump. The heart and the cardiovascular system is a vacuum. It is working in a vacuum. And if you think about it, what you just said about those things that you do not notice that can be increasing or, pulling on your cardiovascular system, it does that to your entire body. Look at it. It's like, is there this deeper connection where I think maybe in the 10 or 20 years from now we'll finally figure it out? There's something going on. The way we think about our body today may totally go on warp speed and be a whole other conversation 10, 20 years from now. But what you and I are talking about today is there are potentials. Is there possibly a different answer, a different way? And we're trying to open up the door to those other possibilities, correct?
Yes, and we're talking about a different understanding. We're also talking about connectedness, and whether it is faith or connectedness with others, it is easier to deal with emotion when there is that connectedness. And one of the points I make in the book is the question, is our emotional resilience today stronger or weaker than that of 2 generations ago? And for a number of reasons, I think our resilience is less. We do not have the support of faith. We do not have strong communities, especially in the cities. And we do not even have large, concentrated families. Families are geographically small and spread apart. Those are big losses and contribute to difficulty in our resilience. And repression is one mechanism of resilience, but we just need more connectedness. We need that reassuring word from somebody else that we don't get. Yeah. It is amazing how powerful reassurance can be, not when given as a text, oh, this is what I should say, but if it's somebody who knows the person and can say it with meaning and not just as words, it can be so powerful.
Absolutely. Well, Dr. Mann, I think there needs to be some more women's and men's groups where you can have those big stacks of dishes and just start saying, let me tell you my stories and let's see what we can get out. Man, goodness, can you imagine? I think people will be lined up, don't you think?
Yeah. They have tremendous power.
Yes, and I think that's so important is what is the power within that you have and can you find it? Or what is the power that you've been denying that is no longer seeming like you can even find it? We have so many times, that little song, This Little Light of Mine, many people will say, my light went out years ago. And right there, that's an indicator. What happened? Where did your power go? And can we help you light that again, right?
Yeah. I mean, it's amazing. I encounter patients who are grieving a loss and suffering. And if I know that patient, I wouldn't say it at a first visit, obviously, but if I know that patient over time, I can tell that patient sounds like a normal grieving process. And even though you feel like there's no light at the end of the tunnel, I know you. I know you're going to be all right. It just takes time, but I'm confident you will be good. I know you. And you can't do it as a script. You can't just say it because it's the right thing to say. And I wouldn't say that to every patient.
Yeah. It's so different. Well, Dr. Mann, what we've talked about today is how we walk in this world and how the world is just shining back on us and how our bodies are reacting. And I thank you so much for sharing with us. Can you share with the listeners how to find out more information about your work?
Well, the book, Hidden Within Us, covers a lot of that territory. I mean, my other book on hypertension in You, is about the drugs, how to know to individualize who should get what drug and what drugs are good and what drugs are bad. That's a strictly medication book. Mm-hmm. Hidden Within Us conveys these patients' stories and make this understanding unavoidable. It's written in English, not in psychobabble. Right. And it is understandable, and it relates to so many conditions: chronic fatigue syndrome, migraine, unexplained anxiety, inflammatory bowel disease, etc. And it just creates that understanding in language that it's a new understanding, but it is so obvious once you read the cases that there could be no other explanation for this phenomenon other than exactly what we're talking about.
Absolutely. And the book is available on Amazon, correct?
Yes.
Very good. Well, Dr. Mann, it was such a pleasure to have you with us today. We thank you so much for sharing, because I think that so many people are starting to say there's got to be something else out there. And, hey, if we keep on asking, we can keep on exploring and maybe help each other expand this profession. I think it's just so incredible that some doctors, you go in and it's sort of like, there's the number, here's your drug, see you later, and you just go, oh, there's got to be so much more. Yes. Yes,
and I have to say, despite all the aggravation of red tape and all that, I find the practice of medicine more stimulating to me than it has ever been. One never gets tired of it because every patient is different. Yeah. Every patient has a unique story, and as the dedication in the book is to my patients who have been my teachers.
Absolutely. If they don't ask the questions, or if they don't say, hey, doc, is there something more, we would have never gotten to where we are today, right?
Yeah, and hey, it's a path of life. It's it's a learning process the whole way.
Absolutely. Well, thank you so much for joining us, Dr. Mann. It was a pleasure to have you with us today.
And thank you for having me.
If you'd like to find out more information about Dr. Samuel-Mann, please do click on the link on the bottom of today's show page to go directly for more information. And it is about being able to say, where are you today? What is it that which you are seeking? Sit down, take a piece of paper, and say, this is what I'm feeling, this is what I would like to find out, and perhaps maybe these are my barriers, or these are my blocks, and how can I work with that? And you go out and you seek, and you ask for help. You listen to radio shows, you check things on the internet, you go to your doctor and you ask them, you go to your priest and ask them. The answer is, it's up to your own exploration of your life path, and are you willing to open a door to something different? Thank you so much for joining us today. This is Dr. Jeanette-Gallagher. Until tomorrow, have a great day.
Today we discussed many life-changing concepts. Who do you turn to, and how do you know what is best when faced with a health crisis? Dr. Jeanette is a patient advocate. She listens to the patient, the doctors, and the family, clarifies the health issues and concerns, then helps the patient make the best choices going forward. If you would like help implementing change into your life and health, we can talk and see where you are stuck and how to improve the quality of your life. Check the link on the bottom of today's show page or visit dr-jeanette-gallagher.com to schedule a phone appointment today.